We're going to start Chapter 12, Upholding Legal and Ethical Principles. This is in your transitions book. Legal versus ethical. So what's the difference in the two? The law mandates how we must behave towards each other. Ethics establishes how we should behave towards each other. May not be illegal to, cuss somebody out on the street, but it's not ethical. So what kind of issues are there in law? There are different sources of law. We have common law, and these are the laws that are binding on future decisions of the lower courts. So they're precedents. So maybe the judge ruled a certain way on this case, and then that case stands from here on out until there's some kind of change in the law, and people can reference back to that, or lawyers can reference back to that precedent that's been set, and they use that for further decisions lower down the court. We have administrative law at the federal level. This is like the Centers for Medicare and Medicaid Services, the National Labor Relations Board. They set laws at the federal level. At the state level, we've got the Arkansas State Board of Nursing. So the rules that they set are legally binding for nurses. Okay? Statutory law, that's your constitutional law. For example, we've got the Nurse Practice Act, EMTALA, and OSHA. Those are just things that kind of dictate what happens in certain situations. Like, for instance, OSHA stands for Occupational Safety and Health Administration, and they ensure safe and healthful working conditions for working men and women by setting and enforcing standards and by providing training, outreach, education, and assistance. So that's an example of statutory law and where those kinds of things are decided. As a registered nurse, you're going to need to be familiar with the principles of confidentiality and the right to privacy, and those are things that we can find in our HIPAA laws, right? With patient rights, the patients do have a right to be treated with dignity and respect. They have a right to privacy. They have a right to make their own decisions, again, for us to be confidential. They have a right to access their health record and the right to refuse treatment if they don't want it. As a nurse, we also need to be familiar with informed consent. The patient has to fully understand what he or she has consented to for that consent to be valid. That's why patients that are not cognitively with it cannot give consent for, say, surgery or even blood products. You would have to get a hold of a family member, a near family member, and hopefully they will have set up a somebody to oversee their medical decisions, like a healthcare proxy. The Patient Self-Determination Act of 1991 went a long way to advance patients' rights, especially in the area of end-of-life issues. So what is assault? We've got assault and battery here. What is assault? It is a deliberate threat to physically harm another person, and it is a crime. So if you're, let's say your patient in the nursing home who is totally paralyzed threatens to whoop your tail. I'm just going to whoop your tail all over the place. Is that considered assault? It is not, and this is why. They have to be able to commit a battery. Okay, so a paralyzed person like that is not able to actually harm you. So also, the person that's being assaulted has to be aware of the immediate threat and they have to be fearful of it. Okay, so it has to be an immediate threat. So for a nurse, it would be something like, if you don't let me give you this injection, I'll have to put you in restraints. That is threatening a person. Okay? Battery. What is battery? That's the actual and intentional act of touching another person without their consent. So this would be if you actually went ahead and gave that injection without the patient's consent. Are there ever times when we give certain medications without the patient's consent? Well, think of mental illness right now. Think of medications like Haldol. Do we give those if the patient is fighting? Sometimes we do. And they're very obviously not consenting to you giving that medication. So you need to make sure that you have the doctor's order and that you document accordingly what the medication is given for. Otherwise, you could open yourself up to a battery charge. Okay, what about false imprisonment? This is verbally or physically forcing an individual to stay in place against his or her wishes, and it's considered an intentional tort. Okay? So examples would be preventing a competent patient from leaving the hospital. Just applying wrist restraints just whenever you want to. There are very carefully crafted guidelines for restraints, and this right here is exactly the reason why. And then I forgot to mention, but an intentional tort that I mentioned a few seconds ago is the deliberate action against a person or their property that causes damage. Okay, so that's intentionally hurting somebody or somebody's property. Whereas there is a negligence tort, and that's when the same action was the result of an accident. So in a nutshell, the law can hold someone liable for injuries whether the person responsible intended to cause harm or not. Okay, so there are certain times when you can be held responsible for your actions even if you did not intend to cause harm. Negligence and malpractice. Look at these numbers here. This is kind of an old study, but in 1999, it was estimated that between 44,000 and 98,000 people a year died in U.S. hospitals because of medical error. Not because they came in and they were sick, because somebody screwed up and did something they weren't supposed to do. Or they didn't do something they were supposed to do. So nurses are key in improving patient safety and improving outcome. Okay? So negligence. This is a failure to use such care as reasonable, prudent, and careful person would use under similar circumstances. So in this case, it would be what would a prudent and careful nurse do under the same circumstances as you're in? Right? So professional negligence is also called malpractice or professional malpractice. And this is improper or unethical conduct or unreasonable lack of skills by a holder of a professional or official position. Okay? This is where you depart from the standard of care that a reasonable and prudent person would provide in similar circumstances. So negligence increases with the more authority and autonomy. Doesn't increase, I'm sorry. Has the potential to increase with the increasing authority and autonomy given to the nurse. Okay, so there's a scripture that says to something to the effect of, to him who is given much, much is expected. That's the premise of it. So it's the same with the nurse. Whenever you're given a lot of responsibilities, that's a lot of accountability, and something that we definitely have to keep in mind, because nurses are expected to practice competently, and you will be accountable for your actions. Okay? What does it mean to practice autonomously? It's the ability of the nurse to act independently. And sometimes we do that within the law without an order. There are certain things that we do without an order. Competence, though, is foundational to autonomy. So if you're not competent in a certain area, you should not be acting autonomously in that area. So in other words, you should be getting yourself more education so that you keep your patients safe and you keep yourself and your licensor safe. Because the public has a right to expect nurses to demonstrate professional competence. Don't you agree? When you go in the hospital and have something done, don't you expect the nurse to be competent? Okay, so let's see. Being accountable for something is just the willingness to assume responsibility and accept any consequences for your actions. And let me just say up front, with me as an instructor, or even you as a practicing nurse when you go out after you get your RN license, always tell the truth. If you screwed up, you just did it. You screwed up, and you have to tell the truth and take responsibility for your actions. Things will go a lot better for you if you do. As a student, if you screw up and you don't tell me, and then it comes out later, there's nothing I can do to help you. Not one thing. And I won't be really wanting to help you because you didn't tell the truth. So always tell the truth and come to me if you're having any problems or you feel like maybe that you have done something wrong. We have to be very careful nurses, and not careless. So we've talked a little bit about a tort. A tort is a legal wrong committed against a person or property. Intentional torts are things like assault and battery, false imprisonment, fraud, invasion of privacy, and slander and defamation. Okay, unintentional torts would be something like professional negligence. You didn't mean to hurt the patient, but you withheld something from the patient that they needed, maybe even not on purpose, and that would be professional negligence. So in order for a person to recover damages from one of these, either an intentional or an unintentional tort, 4 elements must be present. Duty to care, that's an obligation exists to conform to a recognized standard of care. So do we have duty to care when we're working with patients in the hospital or the nursing homes? Yes, we do. We have an obligation to conform to a recognized standard of care. Breach of duty must be present. This must be a failure to adhere to an obligation and deviation from a recognized standard of care. Okay, so you have to be under a standard of care, and then you have to have not adhered to the standard of care. Injury must have occurred. These are actual damages. So somebody has to actually be hurt before a person can recover damages. They have to be injured. Causation, you have to have known that the injury was foreseeable and was caused by a breach of duty, and that the conduct was the cause of the injury. So you either have to know it or you should have known it. Okay. One of the areas of errors in the hospital, it causes a lot of harm to patients, is with medication errors, okay? So if you'll follow the 6 rights of medication administration, this will decrease the likelihood that you will have a med error. Okay, so what are the 6 rights? The right patient, the right drug, the right dose, the right route, the right time, and the right documentation. So I always kind of make up a silly thing to help me remember different things. So for the 6 rights of medication administration, I say, please do double random taco distribution. And in my mind, I have a random times 2 taco in my head. So please do double random taco distribution. Patient, drug, dose, route, time, and documentation. You can make up whatever you want that will help you remember. So remember that also your duty as a patient advocate includes challenging any physician order that might be harmful for the patient. So the most common malpractice claims against nurses, failure to follow standards of care, we've talked about that, failure to use equipment in a responsible manner. So an example of that might be you may have some equipment in, say, the OR that's supposed to be grounded, or you have to put a grounding pad on the patient's thigh or something for some equipment that's going to be used, and you don't do that and they get burned or electrocuted. That's using equipment in an irresponsible way, okay? Failure to communicate. So that seems like a weird thing, but we always have to be in communication with our patients and their family members. Okay, failure to document. Document. If you didn't document it, it wasn't done. Failure to assess and monitor. So always when I think about failure to assess, I think about some nurses that I've seen where the UAP or the CRNA, not CRNA, CNA, come to the nurse with some out of whack vital signs. And the nurse says to the CNA, go take them again. That's an inappropriate response by the nurse. Whenever you have vital signs that are out of range, potentially dangerous for the person, you need to get up and go assess that patient. And if you don't, there will be a time frame there when you could have been treating the patient for whatever's wrong that is wasted on someone else rechecking the vitals and then coming to try to find you again to tell you about them. And then you have to go in there and recheck them yourself anyway. All right, so failure to assess and monitor. So are you checking on your patients like you're supposed to? You turning your patients every 2 hours? All right, and also failure to act as a patient advocate. We are responsible for those patients and we have to act as their advocate. Sometimes we are the last safety measure between them and death. So, speak up for your patients. Negligence and malpractice. So what kind of things are used to prove malpractice? Your facility's policy and procedures, number 1. Standards of care for the nurse. Any protocols that you have. Your job description. Professional literature. Expert opinions. Your state Nurse Practice Act and the reasonable person standard. Okay, so that means if another nurse that was in your same position, would she or he make the same decision that you did? So we need to follow the above standards and use common sense to decrease the risk of malpractice. And we also have to know how to document accurately, and we have to make sure that we do it. That will be your best defense in a lawsuit. So to prevent negligence and malpractice, make sure that you don't stray out of your scope of service, okay? Only do things that are within your scope of service. You have to stay current in your field of practice. That means we have to keep up with what's going on in our field and stay current. We have to make sure that we delegate carefully and legally. That's why we practice delegation and will continue to throughout the year. We use the 6 rights of drug administration every single time. Don't use workarounds on those scanning systems. You know, there are workarounds. You can use workarounds. People do all the time. If you will use that scanning system as it was made to be used, your risk of hurting a patient by giving the wrong drug or the wrong dose will be decreased exponentially. So don't skip that. Be aware of your own strengths and weaknesses. Know that, hey, they're calling me to work in ICU, but they want me to take a patient on a dopamine drip, and I don't know anything about dopamine drips. I can't do that. That will help you not get in a position where you have negligence and malpractice suits against you. And of course, again, make sure that you advocate for your patient. So, high-risk areas. We talked about medication administration, the wrong dose, the wrong technique, the wrong drug. All of those things happen. In the emergency department, you have some dictates by EMTALA that say who you have to treat and who you don't. So we have a duty to treat patients that come through the emergency room. Now, if you're not an emergency patient, you may sit there for a very long time, and that's okay because that's what the emergency room is there for, emergencies, not for sniffles. And the emergency department is also mandatory reporters for abuse. I don't know if you knew that or not, but nurses are. All nurses are mandatory reporters. So if you don't report an abuse and it gets back or found out that you knew about it and you didn't report it, you're in big trouble. And that is going to be negligence and malpractice against you for sure. Okay, so in the mental health setting, what are the rules on seclusion and restraints at your facility? Who can be admitted? Suicide precautions are very, very big right now. So what are your facility's rules and regulations on suicide precautions? Where I worked, we put all suicidal ideation and suicidal attempts into the ICU in a safe room, which means that we took everything out of the room, all tubing, all curtains. When they were fed their meals, they were on throwaway plates with plastic utensils. So you need to know what your facility's rules are. And other high-risk areas are going to be any kind of specialty area, like ICU, CCU, those kinds of places. So for high-risk areas, medication administration, ER, mental health, and specialty areas. So I think we've talked about this a little bit, but the most common malpractice claims against nurses are failure to follow the standards of care. You didn't use the equipment right. You didn't communicate with either the physician, other nurses, RT, or the patient family. You didn't document, you didn't assess and monitor, and you didn't act as a patient advocate. So just so you know, you do have the right to question assignments, and you have the right to refuse if you think it's unsafe for the patient or for yourself. So the example I gave a little bit earlier about somebody on a dopamine drip and you didn't know how to do that, that is an appropriate assignment to question. And maybe it's that they want you to come in and train and you're not going to be on your own with this patient. That might be a different thing. Okay, I'll take that patient as long as Miss So-and-so goes in with me and helps me learn to titrate this medicine and so forth. Okay? So that's just things to consider.